ER doctors performing anesthesia for GI clinics. I'm Dr. Hassan. This is a spicy one. Gear up. Michigan College of Emergency Physicians just put out this letter on September 18th. Essentially, they said emergency medicine trained physicians have a very specific skill set to manage airways and ventilation that is necessary to provide patient rescue. True. Therefore, these practitioners are uniquely qualified to provide all levels of analgesia, sedation, and anesthesia, moderate to deep to general. Essentially saying that they back the idea that ER doctors can perform anesthesia. Interesting though, ER doctors routinely provide anesthesia in the emergency room in an emergency situation when somebody has to be put asleep because they might not be able to protect their airway, they're bleeding out too much, they're having a seizure, many different issues. ER doctors typically provide anesthesia, or what they call as induction of anesthesia, in these situations. However, the idea that they can provide moderate to deep to general anesthesia is going to come across as very controversial to a lot of anesthesia providers out there. And this is a normal progression of the field of emergency medicine, in my opinion. ER job, as they say, per se, is not as desirable as it once was pre-pandemic. And so, like any other field in medicine, the creep, as they say, which is essentially a term for when a certain specialty starts doing procedures in another specialty, they call it specialty creep. And it's only inevitable, and in my opinion, I think I would rather prefer somebody who does anesthesia all the time to provide deep or general anesthesia for an extended period of time. But with that being said, emergency medicine physicians induce anesthesia all the time. So what do you guys think? It's going to be a hot button issue. There's going to be a lot of comments. Would love to hear from my emergency medicine physician colleagues. Would they want to do anesthesia? Also want to hear from the anesthesia providers. Do you agree, disagree? Where do you fall on the spectrum? I love you guys. I'll see you on the next one.